there. Thank you for joining me today on this episode of SITT, Self-Manageable Illnesses and Their Treatments. My name is Joseph, your pharmacist. So today, I'm going to be talking about diarrhea. The definition of diarrhea. Why do I want to talk about definition of diarrhea? Because sometimes people say to me, I haven't been to the toilet for 2 days. And my question is, how often do you go anywhere? Because the thing is that some people go like twice a day. And some people go like once every day. And some people go like 3 times a week. So you need to understand how frequency your bowel movement is to be able to know whether your frequency to the toilet is normal or not. And so really diarrhea is passage of a loose watery stool that is abnormal for yourself. That is diarrhea. If it's frequent, more frequent than you normally do, and if it is watery, that is when you know you have diarrhea. Maybe you used to go like once every day, now you've gone like 4 times in a day. So that is a diarrhea. And what causes diarrhea? Diarrhea could be due to infections. It could be bacterial infection. It could be viral infection. It could also be to an irritant, something that has disturbed your tummy or your digestive system. Maybe you have traveled somewhere that you're not used to. Maybe you have eaten something that you're not used to. Maybe you have eaten something that is contaminated. Contaminated food, contaminated water. You've been to an area and you have had something. Maybe you didn't wash your hand, or the people preparing the food didn't wash their hands. So contamination could result in diarrhea. All kinds of bacterial infection, like contaminated with E. coli, or viral infection can also result in diarrhea. See, most of the time, the issue with diarrhea in most cases is not that the diarrhea is bad, it's what people have done to stop the diarrhea or to stop the effect of the dehydration. I have always said to people the most important thing about diarrhea is rehydrations, be it adult, be it children. Because when somebody is going to the toilet and passing so much watery stool, they need to replace all the water they are losing, salt and water. That's why we recommend things like oral rehydration salts. That is very key. That is very important in cases of diarrhea. Most diarrheas will resolve after 3 days without even any treatment, with just simple rehydrations. So when somebody is having diarrhea, ideally within 3 days, that diarrhea should resolve. Any diarrhea lasting longer than 3 days is an issue. So 3 days is the maximum. After 3 days, then something is a problem. Also, another thing to look out for is, what are you going to take to stop the diarrhea? Because like I said, the first thing is rehydration salt. You got something like Diarrhoea, that's a common rehydration salt. There's so many kinds of rehydration salt. But also you have to be very careful, because if you're diabetic or you're on blood pressure medication, you need to keep an eye on how much salt is in those rehydration salt. You need to keep an eye on how much sugar is in that rehydration salt, because you don't want to be treating one issue and replacing it with another. So oral rehydration salt is a way to go and is important in managing diarrhea. How long should a diarrhea last, you will ask? I would say really most diarrheas after 3 days will gradually resolve. So any diarrhea lasting longer than 3 days is a problem. I will suggest that you consult your medical practitioner to find out what is going wrong. Also, if you have traveled to somewhere you are not used to, maybe you have left your country and went to another country and come back with a diarrhea, that's a warning sign. My advice is also to make contact with your medical practitioner and explain that you have just come back, because you don't know what you may have picked up. You don't want to be spreading it on or carrying it or causing yourself so many harms. So you have to be careful. So what else can you use to treat diarrhea apart from rehydration salt? It's something you can buy from a pharmacy. We call it loperamide. What it does is reduce your bowel motility and stabilize it. It's called loperamide. So if you're going through a diarrhea, 2 tablets or 2 capsules of loperamide after the first bowel movement, and after 6 hours, you can take another one. My advice is please do not take more than 8 tablets or capsules of loperamide in 24 hours. Now, loperamide is not for kids, not for children. Ideally, it shouldn't be given to someone under 12 years of age. Yeah, it's mainly for adults. And like I said, most diarrheas will resolve after 3 days. Now, I did talk about dangerous diarrhea. What makes a diarrhea dangerous? Number 1 is this. If you're having a diarrhea and there's a blood in the stool, something is not right. My advice is to consult your GP, because you shouldn't be having blood in your stool. Also, for the very elderly and babies, having diarrhea for more than 3 days can be dangerous, because they could lose so much fluid that they can even get dehydrated and go into subconscious and get unconscious and even go into coma. So elderly and babies should be rehydrated as often as possible as long as they're having diarrhea. If their diarrhea is lasting more than 3 days, my advice again is to consult your GP or consult your doctor or consult your pharmacist. Face-to-face consultation is always important, because they might see more things than what you can pick up on the phone or you can pick up online from different advice. So I hope you have gathered something today. Like I said, diarrhea can be dangerous depending on age, depending on duration, and depending on the symptoms accompanying it. People that have inflammatory bowel disease or irritable bowel syndromes, they can alternate between constipation and diarrhea, which is why I've said if your diarrhea is lasting more than 3 days, you need to consult your GP, because definitive diagnosis is key when some illnesses are lasting longer than they should do. Thank you once again for joining me. I hope you're enjoying the different topics I'm dealing with. Share, like, and also get people to follow and like, because these are some common illnesses we take for granted in terms of knowledge on how to manage it. And like I said at the beginning of one of my episodes, 40% of issues and conditions is something we can manage by checking our drug cabinet, by visiting our pharmacy and managing and dealing with them. Thank you and goodbye for now.